Good afternoon, everyone. Thanks for joining our monthly healthcare provider briefing webinar, where we share relevant public health updates regarding COVID-19. My name is Dr. Cindy Shen, and I'm a public health physician at York Region Public Health. I'll be presenting this webinar with my colleague, Dr. Joanne Fernandez, who's also a public health physician here. As always, a very big thank you to the team who put this together. In addition, before we start, we would like to recognize and thank Dr. Karim Kurji for his leadership during this pandemic and for the past 15 years or so as Medical Officer of Health here in York Region. For those of you who may not know, Dr. Kurji will be retiring later this week. He'll be missed here, and we wish him a happy retirement. Next slide, please. So a few housekeeping items before we start. Throughout this meeting, you'll be able to ask questions or comment using the chat box. Questions will be sorted to avoid duplication, and we'll try to go through as many questions as we can during the Q&A session following the presentation. Your name would not appear on the screen to attendees, although the presenters and moderators will have this information. And this meeting will be recorded. So if you have any questions about the recording, please contact HEOC Liaison at the email address noted here. Next slide. So to ask a question, you can click on the Q&A icon on the right side of the screen. You can then type your question in the compose box and select send. Questions will be screened by the moderator and then posed to the presenters. As mentioned, we'll get through as many questions as we can during the webinar, and answers to any outstanding questions will be sent out through Public Health Matters at a later time. The slide deck for this presentation will also be shared following the webinar. Okay, next slide. So we have a pretty packed agenda today. We'll start with some epidemiological updates, followed by changes in local and provincial policy and guidance. We'll then go through COVID-19 vaccine and related updates, followed by some information on the universal influenza immunization program for this flu season. Next slide, please. We'll start with some epidemiological updates for York Region. So York Region is currently experiencing a fourth wave of COVID-19. However, the number of new cases appears to have plateaued since early September. And as of September 24th, the 7-day average of daily new cases was 58. And the average number of daily cases seen in this wave has surpassed that experienced at the peak of the first wave. Household close contacts and local transmission are the main drivers of transmission during the fourth wave so far. The number of ever hospitalized cases also increased since late August, although this also appears to have plateaued. And of course, we're keeping a very close eye on these numbers. Next slide. Delta continues to be the dominant strain here in York Region and in Ontario. The vast majority of cases reported are confirmed to be Delta by whole genome sequencing or presumed to be Delta based on the mutation testing results. Given what we know about Delta and its contagiousness, continuing vigilance is crucial. And of course, Public Health Ontario continues to monitor the situation with Delta and other variants, including the Mu variant or the B1621 variant, which is currently still a variant of interest instead of a variant of concern. The information that we last received from Public Health Ontario suggests that the proportion of cases attributable to the Mu variant has been stable overall, and in fact has been decreasing over the past weeks. So currently, there's no indication that Mu would outcompete Delta. And of course, surveillance of new variants continues to occur in Ontario and in Canada. Next slide. So if we look at the rate of cases by vaccination status, we can see that the risk of COVID-19 infection is much greater among unvaccinated individuals. So as an example, from September 12th to 18th, the risk of COVID-19 infection among the unvaccinated vaccine-eligible population was 9.5 times higher than that among fully vaccinated population. So vaccine continues to be our best defense against this particular infection. Next slide. Similarly, if we look at hospitalization by vaccination status, the vast majority of those ever hospitalized cases were not fully vaccinated. and almost all of the cases ever in the ICU were among unvaccinated and partially vaccinated individuals. In addition, deaths during the fourth wave have only occurred among unvaccinated individuals. So all of this data really indicate that the vaccine continues to be highly effective against symptomatic disease, especially against severe disease, hospitalization, and death. And we continue to recommend full vaccination for the protection of the individual receiving the vaccine, but also for those they may interact with and the community at large. This is especially important now, given we're in the fourth wave and considering the transmissibility of the Delta variant. Next slide, please. Finally, looking at the outbreak situation here, the number of outbreaks in York Region has been increasing since mid-August. On September 23rd, there were 10 confirmed outbreaks in the region, 3 in childcare settings, 3 in schools, and 4 in workplaces. It's great that currently we have no confirmed outbreaks in institutions such as long-term care homes and retirement homes, given the high vaccine coverage in these settings. However, it's important to note what's presented here is really the number of confirmed outbreaks. And in addition to these, we're also investigating and monitoring a large number of facilities under surveillance or suspect outbreak, including at least 53 schools which are under surveillance. Next slide, please. So given the fourth wave, there were a number of policy changes recently, both provincially and locally. Starting on September 22nd, Ontarians need to be fully vaccinated 14 days prior and provide their proof of vaccination along with photo ID in order to access certain public settings and facilities. This approach focuses on high-risk public settings where facial coverings cannot always be worn, such as indoor restaurants and bars, event spaces, cinemas, and theaters. And currently, paper and PDF vaccine receipt can be used. That being said, an enhanced vaccine certificate as well as a verification app to allow businesses to read a QR code are expected to be made available beginning October 22nd. Individuals who cannot receive the vaccine due to medical exemptions will be permitted entry with a note from a physician or a nurse practitioner until recognized medical exemptions can be integrated as part of a digital vaccine certificate. And here are a number of links should you like more information, including a really helpful Q&A document. Next slide, please. So the Ministry of Health has a document on medical exemptions, which summarizes the situations where someone may qualify for a medical exemption to COVID-19 vaccination. It is very important to note that true contraindications to COVID-19 vaccination are very rare, and medical exemptions are only allowed if certain conditions are met. So for instance, there are usually requirements for investigation by and discussion with an allergist or immunologist or another relevant specialist. The option of another vaccine having been explored, and also the exemptions may be time limited in nature. The categories of potential medical exemptions are listed here, which include very few conditions and a few APHE situations, which would generally require discussion with a specialist. Some of the contraindications to AstraZeneca vaccine, in which case mRNA vaccine should be considered, and active administration of monoclonal antibody therapy or convalescent plasma therapy for the treatment or prevention of COVID-19, which should be a time-limited exemption only. For your information, the link to the document is provided here, along with a sample template for medical exemption from the Ministry of Health. Next slide, please. And just last Friday, the provincial government announced that they are cautiously easing capacity limits in certain settings where proof of vaccination is required, as public health and healthcare indicators appear stable and the proof of vaccination is now in effect. So effective September 25th, capacity limits were increased in many of the indoor settings where proof of vaccination is required, such as meeting and event spaces, sporting events, concerts, and cinemas. The limit set in these locations is 50% capacity or 10,000 people, whichever that's less. For certain outdoor event venues where patrons stand, the capacity limits increase to up to 75% capacity or 15,000 people, whichever is less. And for certain outdoor event venues where patrons were seated, capacity limits increase to up to 75% capacity or 30,000 people, whichever is less, recognizing the risk of transmission may be lower given reduced mobility. In addition, proof of vaccination will now be required in outdoor settings where the normal maximum capacity is 20,000 people or more to help keep these venues safer for patrons. Next slide, please. In addition, York Region's Medical Officer of Health has issued a number of orders and instructions for York Region residents and businesses. For instance, all residents in York Region must continue to adhere to the Section 22 class order, which requires the public to follow instructions from York Region Public Health to self-isolate, for instance, when they are a confirmed or probable case or a close contact. All residents and businesses in York Region must also adhere to the Section 22 class order, which requires all persons responsible for hosting social gatherings at private or commercial gatherings to maintain a list of names and contact information for attendees, which is important for supporting contact tracing. York Region businesses and workplaces must also continue to follow the letter of instruction, which requires all businesses and organizations to cooperate with public health for the purpose of investigation and contact tracing measures, and to support vaccination for staff. In addition, York Region childcare operators must follow the letter of instruction, which sets out requirements for childcare operators on a number of measures, including daily COVID-19 screening, masking, physical distancing, maintenance of attendance records, restrictions of persons entering the premise, and cooperation with public health. Next slide, please. So looking at some provincial guidance changes now, the definition of fully vaccinated status has changed, so that in addition to having acquired a full series or combination of Health Canada authorized vaccines, it now also includes those who received 1 or 2 doses of a COVID-19 vaccine not authorized by Health Canada, followed by 1 dose of a COVID-19 mRNA vaccine authorized by Health Canada. In addition to those who had 3 doses of COVID-19 vaccine not authorized by Health Canada. And of course, 14 days must have passed since they received the last dose of their vaccine. It's again important to note here that even for those fully vaccinated, if they become symptomatic or test positive, they still need to isolate. Also, fully vaccinated individuals should continue following public health measures, including physical distancing and masking. Next slide. The guidance for individuals vaccinated outside Ontario or Canada was also updated to reflect the change in definition of full vaccination. So for those who received the first dose of a COVID-19 vaccine authorized by Health Canada outside of Ontario or Canada, they should complete their vaccine series as close to the interval recommended by Ontario as possible. For those who received COVID-19 vaccines not authorized by Health Canada, if they have proof of vaccination and have received a complete 1 or 2 dose series, they should be offered 1 additional dose of an mRNA vaccine here. On the other hand, if the individual has already received 3 doses of a vaccine not authorized by Health Canada, no additional doses will be offered. For those who received an unknown COVID-19 vaccine product, it's important to consider whether further investigation can be done to obtain proof of immunization. And if the COVID-19 vaccine product used for the previous dose remains unknown, or if written proof of immunization is provided for a vaccine whose generic or trade name is not recognized as per the appendix in this particular guidance document, then a new vaccine series would need to be started with a Health Canada approved COVID-19 vaccine. For more information, you can refer to the guidance linked here, which contains an appendix that outlines a list of international COVID-19 vaccines, their characteristics, and the recommendations for additional doses. And of course, individuals who have received partial or complete COVID-19 vaccine series outside of Canada or Ontario should contact their local public health unit with a proof of immunization in order to have their immunization record documented in COVAX prior to receiving any additional doses and also for their vaccine receipts. Next slide, please. The COVID-19 reference document for symptoms was also revised, and accordingly, a number of screening tools from the Ministry of Health were updated. This reference document for symptoms mentions two categories of symptoms. The first are the most common symptoms of COVID-19 that would require immediate self-isolation and COVID-19 testing. On the other hand, there are other symptoms of COVID-19 specifically for high-risk contacts that would require testing and isolation. So for any close contacts of a case, even if they had mild or atypical symptoms, they would still need to be tested for COVID-19. So next, I'll hand it over to Dr. Fernandez to speak about York Region's specific screening tool for schools and childcare, along with vaccine and related updates.
Thanks very much, and good afternoon, everyone. So as of Friday, September 3rd, we did roll out our specific screening tool for schools and childcare settings, which can be found at the link here on the slide. We require all York Region students, staff, and visitors to complete York Region's screening each day prior to attending their programs or school. Of note, this is different from the provincial screening tool, which is used in all other non-school settings in York Region, and I'll speak further to some of these differences next. Next slide, please. So the York region-specific screening tool does include a runny nose and sore throat, as well as muscle aches and extreme tiredness to capture some of the malaise-type symptoms that we may see with COVID. We have found, based on our data from the past year, that many children with COVID presented with runny nose and sore throat as their first symptoms. And while these symptoms are, of course, also associated with other viral URTIs, we have elected to use a more cautious, sensitive approach to start off the school year. And this is with the goal of really keeping COVID out of as much as possible and minimizing the disruptions that may come from cohort dismissals as a result of a case. Next slide, please. And in addition to the symptom screening, there are other criteria as well that are included in the screening tool, such as a screening for contacts in the household that may be experiencing COVID symptoms. This piece is similar to the provincial screening tool. Next slide. One other thing to note is that this year we are requiring that symptomatic students stay home until they receive a negative COVID test result and symptoms are improving for at least 24 hours and any GI symptoms have resolved 48 hours, or it's been 10 days since their symptom onset, or they receive a definitive alternative diagnosis by a healthcare professional that is not a transmissible illness with symptoms that are compatible with COVID. So for example, this might be your child with allergic rhinitis or asthma. Next slide. Talk next about some of our vaccine updates. So in terms of vaccine coverage here in York Region, as of September 21st, we've had close to 8% of York Region residents aged 12 years and older have at least one dose of the COVID vaccine, and approximately 81% have doses. As mentioned in previous webinars, you'll note that York Region residents aged 25 to 29 years old currently have the lowest first and second dose coverage among all age groups. And we just wanted to bring this to your attention because it's important, of course, for any outreach or counseling that you may be doing currently in your practice. Of course, we did see an increase in bookings as well for vaccine following the announcement of the vaccine certificate in Ontario. Next slide. And now that the percentage of vaccinated residents is really quite high, the large-scale immunization clinics have closed, although we do maintain hub clinics in the community that you'll see detailed on this slide. And also just a note that a new clinic will be opening up on October 1st at Richvale Community Center in Richmond Hill. And the details will be added to our website as well when they're available. The York Region staff have been busy targeting vaccine outreach to areas that have lower vaccine uptake and hosting clinics in locations that are easy to access. So that would include shopping malls, theaters, immigration centers, schools, and places of worship. Of note, today, September 27th, we're hosting a clinic at the Royal Canadian Legion in Sutton. And on September 30th, we'll be at the RioCan Vaughan Shopping Centre. In addition to all of this, York Region's also been hosting clinics at long-term care homes and high-risk retirement homes to give third doses, which we'll talk about a little bit further on. Next slide, please. And just a reminder as well that Moderna and Pfizer vaccine is available to be ordered from York Region Public Health for administration in your offices. If you're interested in storing and administering the COVID vaccine and haven't done so in the past, please fill out the readiness survey that's linked here and submit it to COVID-19 vaccine at york.ca, and we'll be in touch to walk you through that process. If you have any additional questions as well, please reach out to HEOC liaison at york.ca. Next slide. And I'm sure many are already aware that on September 16th, both Pfizer and Moderna COVID-19 vaccines were given full Health Canada approval for anyone aged 12 and older. And with the approval of the vaccines, Health Canada also revealed the new name. So Pfizer is now called Comirnaty, Moderna is called Spikevax, and AstraZeneca is Vaxzevria. And of course, Health Canada stated that the only changes made were to the names and not to the vaccines themselves. We also know, as per some of the media stories, that Pfizer has submitted their for vaccine trials in children aged 5 to 11 for approval, and we're expecting approvals towards the end of the year. Next slide, please. So on September 14th, the province issued some guidance on third dose outlining who is eligible to receive a third dose. And it's important to note that these are not booster doses, but they're third doses of a primary series. So I won't go through the full list of conditions for eligibility, but it is here on the slide for your reference. And generally, the third doses will be given to those who are moderately to severely immunocompromised and who are living with the conditions that are outlined in the list here, and as well as residents of long-term care homes, high-risk retirement homes, and other care lodges. And so the individuals in these groups can receive their third dose at a recommended interval of 8 weeks following this second dose, and they'll be contacted by their healthcare provider. And this may include a primary care provider, a specialist, or their hospital specialty program for when they're eligible to receive the vaccine. The guidance document, just to bring your attention, as per NACI, has said that the minimum interval should be 28 days. However, an interval that's longer than the minimum 28 days between doses is really more likely to result in a better immune response. And so the exact timing should be decided with the treating provider in order to optimize the immune response from the vaccine series and minimize any delays in the management of their underlying condition. And healthcare providers can access the updated third dose eligibility referral form at the website link here on this slide. Next page, please. And so we just wanted to briefly touch on ivermectin because we know that this has been a hot topic recently. So on August 31st, Health Canada released a safety alert about the improper use of ivermectin and advising Canadians not to use either the veterinary or the human drug formulations for prevention of COVID. There's really no current evidence that ivermectin is safe or effective for this purpose and can have some serious health consequences as well if used improperly. And as you all would know, ivermectin is a prescription medication that's authorized only for the treatment of specific parasitic infections in Canada. There are also veterinary formulations that are, of course, not intended for human use or consumption. And the veterinary version of ivermectin, especially at high doses, can be dangerous for humans and can result in a number of health issues such as vomiting, diarrhea, low blood pressure, allergic reactions, dizziness, seizures, coma, and death. So really, everyone who's eligible is encouraged to get fully vaccinated as soon as possible. Vaccine remains to be the most safe and effective way of preventing COVID infection. And as we've already discussed, there are many convenient options, both walk-in and appointment, that are available on our website. Next slide, please. And a note as well about pregnancy and COVID. This table here is from the document that was released Ontario COVID Science table that outlines a few things. So first, the rates of COVID do not appear to be higher in pregnant women, but there was more asymptomatic infection being detected. And pregnant individuals do not experience a higher severity of illness compared to non-pregnant people, with increased maternal morbidity and mortality, obstetrical conditions, higher C-section rates, and neonatal complications in those who have had COVID. Unfortunately, despite this, we are seeing low vaccine uptake in pregnant people, even with their reassuring safety and efficacy data. And so it's important to encourage patients who are pregnant or those trying to become vaccinated as soon as possible. And secondly, also important to encourage patients' partners and others who may be in their close circle to be vaccinated as soon as possible to reduce the risk of the patient. And this is in line with the statement from the Society of Obstetricians and Gynecologists of Canada. As well, according to recent studies, COVID-19 vaccines have not been shown to increase the risk of miscarriage, and there's also no evidence that the vaccine affects fertility. On a more practical note, we also just wanted to mention that a letter from a healthcare provider is not required for vaccination of a pregnant patient. Next slide, please. And so again, this is another thing that I'm sure many are very familiar with. So long COVID or the post-COVID condition describes a range of symptoms which can persist for months after severe, mildly symptomatic or asymptomatic COVID-19 infection. And the most common reported symptoms, and there are many that have been reported, include fatigue, shortness of breath, pain, sleep disturbances, anxiety, and depression. And to give you a sense of sort of the burden of illness that we're seeing, a conservative estimate suggests that 57,000 to 78,000 Ontarians had or are currently experiencing the post-COVID-19 condition. And again, I think in terms of the message, it's that vaccination is really the best to prevent long COVID. And that happens in two ways. So first, it reduces the likelihood of the condition by reducing the chance of becoming infected to begin with. And then vaccination may also reduce the likelihood of developing post-COVID condition among those with breakthrough infections. Next slide, please. We've also been receiving many questions around serology and antibody testing for COVID. And generally, just wanted to reiterate that serology should not be used as a diagnostic or screening test for COVID-19. Serology is not recommended to assess for immunity for COVID following immunization, or to make immunization decisions. And this might be even, serology following natural infection. So we don't recommend it and the antibody results do not correlate with the recovery or infectivity. Next slide. And anyone who's been infected with COVID is eligible and encouraged to get their full series of vaccine as soon as possible following the end of their isolation period. So there's really time following infection with COVID-19. As soon as they have completed their isolation, they really should be encouraged to receive the vaccine as soon as possible. Reinfection is happening, and vaccination following infection leads to a very effective immune response that can help. And we see this especially against variants. Next slide, please. And we just wanted to bring your attention as well to some vaccine resources that are out there. So the VaxFax clinic is something that patients can connect over phone with doctors from the Scarborough Health Network to answer questions about the COVID-19 vaccine. Of course, there's a wealth of information on our websites as well. So we have our specific vaccine FAQ page with the link on the screen. And we also have our vaccine clinic page where people can go to get the most recent information on some of our hub clinics and vaccine pop-up locations. Next slide, please. And so I'll pass it over now to Dr. Shen, who will talk about our universal influenza immunization program.
Thank you, Dr. Fernandez. So besides the COVID-19 vaccine, it's also important that people get the influenza vaccine when it becomes available. So we're providing you with some information here. You should also expect to receive an ENS from us on this sometime next week. The Ontario Universal Influenza Immunization Program, of course, offers influenza vaccine free of charge each year to individuals 6 months of age and older who live, work, or go to school in Ontario. We know that vaccination is important for preventing influenza-related illness and complications, and it's especially important this year to get vaccinated against influenza to help preserve healthcare capacity, prevent severe illness arising from potential co-infection with COVID-19, and given the gradual relaxation of some of the public health measures. The publicly funded influenza vaccines available for this season's influenza immunization program really includes quadrivalent inactivated vaccine for those 6 months of age and older, and different vaccines have different minimum eligible age indications, which can be found in the table linked here. The high-dose quadrivalent inactivated vaccine is available for those age 65 years old and older, and similarly, the adjuvanted trivalent inactivated vaccine is also for those age 65 years and older. There is a ministry webpage linked here, which includes multiple Q&A documents should you like more information. Next slide, please. And each year, the ministry receives a supply of influenza vaccine in multiple shipments from the manufacturer starting in mid to late September and continuing into November. This year, the total vaccine quantity ordered by the ministry represents a significant increase compared to last year. The timing of immunization differs so that the most at-risk populations are prioritized. So in October, the focus would be on individuals at high risk of complications due to influenza and also healthcare providers. And then in November and ongoing, this will be extended to the general population. And of course, those aged 65 years and older are of a higher risk group. Within this population, those living in congregate settings, such as long-term care homes, and those with multiple comorbid conditions should be prioritized to receive the QIV high-dose vaccine, while others can receive the adjuvanted TIV and the regular QIV vaccines. And as mentioned, there is actually a Q&A document from that ministry webpage specifically focused on immunization of older adults, should that information be helpful. Physicians and pharmacists across the province should start receiving influenza vaccine by roughly mid-October, and providers wishing to conduct large-scale influenza community vaccination clinics are suggested to wait until November to ensure that an adequate supply of vaccine can be ordered based on the availability. Also, based on information received from the ministry at this time, co-administration of influenza and COVID-19 vaccine is not recommended. However, this is currently being reviewed by the National Advisory Committee on Immunization, and any changes in the provincial recommendation will be communicated quickly. It was also mentioned that given current recommendations for no co-administration, the more immediate and continued risk of COVID-19, generally speaking, COVID-19 vaccination should be prioritized. And lastly, as mentioned, please do watch for communication from York Region Public Health to primary care providers, which is planned for next week. Next slide, please. So then we'll go over some questions together. We have roughly 10 minutes, so we'll do our best here. Looking at the list here, the first question is if a patient received another COVID-19 vaccine, such as Sinovac in China, that's not approved in Canada, is there a need to revaccinate with the mRNA vaccine? So this was already presented in one of the earlier slides. And as mentioned, if they've only received one or two doses of a non-Health Canada authorized vaccine, they are eligible and should be receiving another dose of an mRNA vaccine that's authorized here. And I would encourage you to take a look at that particular document, specifically that appendix in that document, to get the appropriate advice regarding what to do in that particular situation, depending on the brand of the vaccine. The next question is, if people are traveling from the USA, do they need a specific COVID-19 vaccine certificate or passport for their daily activities? So according to the Q&A document from the province that was actually linked to one of the slides, patrons from outside the province or the country will be required to show that they're fully vaccinated against COVID-19 and identification in order to enter specific settings. The proof of vaccination will be accepted if the person's name and date of birth on their identification document matches the vaccine receipt with the same date of birth and name, and if the person's actually fully vaccinated as per the regulation. So that Q&A document, again, would be a helpful resource should you want more information on this topic. The next question is, can the rapid COVID-19 home swab test be used to clear symptomatic children for return to school if negative? So this is an interesting question. Looking at the August testing guidance from the province, so this was published later in August, self-testing kits should be used for screening purposes only, and that it should not be used to test for COVID-19 infection in symptomatic individuals or individuals with known contacts with a case or in outbreak situations. I'm not sure. I'm just going to check with Dr. Fernandez as she might be more familiar with the schoolwork to see if there's anything that you may want to add to that.
Nothing further to add. It's as you've said, that the rapid tests are not recommended for children who, or for anyone for that matter, who are symptomatic or high-risk contacts.
Perfect, thank you. Okay, so there was some questions about booster doses and indications, specifically the type of biologics. So I think there is a web page, or rather a document on this already that you may be able to take a look, and we can also provide some additional guidance in a follow-up FAQ document as appropriate. There's a question about sending patients who had significant side effects or allergic reactions, not clearly anaphylactic, where they could be sent in order to inform about second dose advice. So this is a really good question to bring up because we do want to hear about any adverse events following immunization or the APHEs, and regulated health professionals are required to report to us should that be the case. So please do let us know, let public health know. In the meantime, depends on your clinical judgment. If you think this is an allergic reaction, the best next step would be to consult with a allergist or immunologist. And so you can start that process before we start the investigation ourselves. I think similarly, there was a question about the marketing surveillance of adverse events following immunization, and that some may not be reporting. So again, this is a requirement under the existing legislation and regulation. Our public health unit did issue multiple ENSs to the healthcare providers in the community already. We'll try again to relay that message again, but again, the idea is that any regulated healthcare providers, please report these AFI information to us. It's very important. There was another question about breakthrough infections in fully vaccinated individuals. So again, this is a really interesting topic, and information continues to emerge from the literature. So what we know about the breakthrough infection so far is that the vaccines still appear to be protective against symptomatic disease, even when breakthrough infections happen. And also to note, it's really important to know that vaccinated individuals with the Delta variant breakthrough infections actually appear to spread the virus for a shorter period of time as well. So not only is the vaccine helpful for preventing severe outcomes in people who get vaccinated, it could reduce, it could also protect people who are around those, even though they develop a breakthrough infection essentially. So please continue to encourage your patients to get vaccinated. There's a question about how long to wait between vaccines not recognized by Health Canada and having an mRNA vaccine in Canada. So the information I was able to glean from the ministry document was that the minimum interval should be 28 days. But again, I think you should consult with that particular document and appendix to make the decision based on the actual vaccine that was administered. I'm just trying to see if there's anything else here. There's a question about Janssen vaccine availability. I'm not aware of that being available in Ontario, but it's something that perhaps we can follow up on to confirm. Just going to see what else is here. So how far apart should COVID vaccine be from flu vaccine? So that's a really good question. This information should actually be available in the Q&A document from the ministry, in addition to the NACI statement, because that's actually what they're following. So the language is that, if possible, COVID-19 vaccine should be given at least 14 days after other vaccines or 28 days before other vaccines to help avoid possible overlapping side effects. That again, in terms of the actual evidence, there's potential but unknown interference when it comes to immune response. And again, this issue is actively being looked at by NACI, followed by the provincial government. So hopefully there will be updates coming in the near future as well. So I recognize that we are almost at time here. I know that there may be a number of other questions, so we will compile the questions that weren't addressed during this session and share the answers accordingly through Public Health Matters afterwards. So maybe we'll just wrap up now, if that's okay. Can we move on to the next slide, please? Okay. Thank you. So here are some web pages that you may want to bookmark because it includes some helpful resources and information. Next slide, please. And finally, just a reminder that you can subscribe to our Public Health Matters email list by going to the Health Professionals webpage and clicking on e-newsletter for healthcare professionals. Please also do spread the word and encourage your colleagues to sign up as well. Also, as mentioned, we will be sending out these slides after the webinar, and hopefully that's helpful because there are a number of links that you could click on. And next slide, please. So that concludes the webinar. Thank you again for your participation today, and take care, everyone.